was also during COVID, and I remember you just saying, I need a therapist, or, you know, I need to speak with someone. You know, I'm just not doing well mentally, you know, and anxious and, you know, depressed. So that's what we did. So we just advocated and sought out what help would be best for you.
So I went to 2 high schools. I went to a public school and a private school. So they offered different types of supports. The public school offered multiple levels of more serious supports. So one, you could end up in a different school, like an entirely separate school, or just kind of take a separate class within the school system.
So at Gwyn's school, there was a guidance counselor that was readily available to all the students at the school, who is there just to, you know, assist the children with academics or grades or even college. But they're also a support for the student to talk with if they're having other issues, such as mental health issues or anxiety or whatnot. But if a student like Gwyn needed more support, there was also a school psychologist who Gwyn would set up, you know, meetings that you'd have to set up and seek out specifically. And this was support. Some students I know could meet with the school psychologist weekly or, you know, bi-weekly, things like that. So I think, if I recall, Gwyn met, you know, maybe once a week when things, you know, if she was anxious or something like that. So she had the support of both the guidance counselor at the school and the school psychologist, so that was helpful. And they could also point us in the direction if we needed more supports outside of school, which we did seek out based on need, you know, later on.
I would say that school-based mental health resources impacted my well-being a tremendous amount. I think they allowed me to get the support outside of school that I really needed, but when I was in school, they acted as a buffer that allowed me to be stabilized in that position. So although that I did need to seek outside resources, it was those in-school resources with guidance counselors and school mentors that really kept me afloat, especially when academics were really, really hard at the time.
Just keeping open and relationships with Gwyn's teachers and even the school principal and her mentor, guidance counselor, and these positive relationships just really helped her along the way. I mean, I remember specifically Gwyn was anxious one day and maybe had, you know, a lot of anxiety, and the principal called me, and he was so understanding, and we just had a really good relationship and open, and I think to lean on the teachers, principal, staff, all of them can be helpful, and they were so supportive of Gwyn, and that was great. That was great.
Yeah, and I would add that a individual that made a huge difference for me was my mentor, but she actually started off as just my teacher, and I grew really close to her, and my school had a mentorship program where you could put down someone that you felt close with and they would assign you with that person. So I was really lucky, and I was able to get this teacher who I felt really connected with, and she really helped me find new, kind of get away from old negative habits, make new friends, keep me in check about my academics, as well as about making sure I live a balanced lifestyle. So even though she didn't have all of that mental health training, she still played a huge role in my getting better and helped me feel more connected to the school, others, and to myself.
And if I can add that same mentor that Gwyn was talking about, I had a meeting with her, and just were talking about everything. We were even talking about how Gwen moved to this, private school, and she didn't know a lot of people yet, and have a lot of friends there, because she just got there. And this teacher just said, "Hey, I wonder if Gwen would like to do this after-school program that we do." And she's like, if she wants to try it out. And I said, "Let me ask Gwen." And Gwen did it and ended up loving it and made so many nice friends, and still even goes back and visits those girls and the program and the teacher. And so it was just so nice that teacher had so much support for Gwen, that she looked outside the box and even thought, hey, this would be something that would be beneficial for Gwen, which it was.
So that's why it's so important for both parents and teens to be able to receive this information, because it takes both parties to help someone get better and help someone heal. Because you can't do it alone. So it's so important for parents to know what resources are out there, and for the teenager to also know that.